Module 3 covers the goals of the Perinatal Palliative Care Coordinator. These goals were identified through interviewing expert care coordinators. The learner at the end of this module should be able to list the goals of the Perinatal Palliative Care Coordinator and state 2 ways that each goal could be achieved. 5 goals for the Perinatal Palliative Care Coordinator are listed here. The center of these goals is the parents while they work towards making the best decisions possible for themselves and their babies. Each one will be presented individually, but they are all interconnected. Goal 1 is to create a safe space for parents. The news that there is something terribly wrong with their unborn baby has rocked parents to their core. Their world has been turned upside down. Therefore, the care coordinator must have as her first goal to create a safe space for the parents where they feel they can say whatever they want, express their feelings, and share their hopes and fears without any judgmental responses. This can be done by being welcoming to the parents to provide a quiet and private place for talking. Your verbal and nonverbal interactions must be non-judgmental. Avoid meeting a new family with your own agenda, checklist, or time schedule. This will leave you open to the family needs and concerns. Your calm and non-directedness will convey to the parents that you are there for them and you are listening. Your second goal is to meet the parents' needs. Asking the mother and others what is most important to them puts them in charge. Their needs are the most important thing for you to hear. After you ask your opening question, pause calmly without expectation. Listen to what they say. You can only know their needs by asking and listening for them. Learning how to listen is the most important critical skill for you to develop. Work to hear how this shocking news is perceived by the mother and family through their eyes. Listen to what is said, by whom, how it is said, and the words that they use. Listen for misunderstandings they may have about their baby's condition, or about how care is provided, or about the options open to them. Through conversation, you can begin to learn their values, how they make decisions, and what influences those decisions. The goal of developing a therapeutic relationship is a necessary one if you hope to be helpful to the parents. As a healthcare provider, one needs to engage with patients in a meaningful, empathic way. The care coordinator usually has an ongoing relationship with each family, so she becomes familiar and the parent and other family members know and trust her. This is accomplished through open and honest communication based on a foundation of trust that parents can say whatever they feel or need to say. Genuine caring and concern by the care coordinator will allow the expressions of both worries and hopes. As in any relationship, it is helpful to be accessible to parents, but within reasonable boundaries that are stated. It is important that contact information is provided to the parents with details about your accessibility, including boundaries of availability. Off-hour contacts should also be provided. Conflicting opinions or desires are not uncommon between family members, especially in stressful situations. Mediating the needs of each parent can often be done through identifying common ground. Conflicts with other professionals can also arise, and the care coordinator plays an important role in recognizing and working out any disagreements. Goal 4 is to ensure mutual understanding of baby's condition. Medical terminology is often unknown to parents, especially conditions in a newborn baby. Therefore, by listening to the parents explain what they know about their baby, the care coordinator can hear their interpretation of what they have learned thus far. Avoid correcting them as they speak. Rather, wait until they are done to clarify their understanding. Write out diagnoses and diagnostic tests for them so they can see the exact words. Provide them with handouts if available. There is likely missing information about the baby's condition. Care coordinators are often choosing which specialists parents have the option to see. Assist them to meet with appropriate specialists. Follow up with parents after the visit provides an opportunity to interpret what was said, educate them about the condition, its implications, and what to expect as far as prognosis, morbidity and mortality, and likely quality of life. The main goal is for parents to have an understanding of the baby's condition that is as accurate as possible, given their own desire for detail versus the big picture. Care will be less fragmented when coordinated by a member of the interdisciplinary team, such as yourself, who has the ability to see the whole picture and the family within that picture. This requires sharing information with the family and each member of the professional team. Inherent in perinatal palliative care is the involvement of obstetrical, maternal-fetal medicine, neonatology, and palliative care. Maternal care and newborn care are two separate specialties. Palliative care is another. For parents, these are three different teams of people, often requiring separate appointments, different buildings, etc. Add the need to meet with such as a neonatal cardiologist or nephrologist, and parents become overwhelmed. They have to repeat their story over and over, which is exhausting and frustrating. The Perinatal Palliative Care Coordinator can serve as coordinator of care, making phone calls, scheduling appointments, and sometimes accompanying the family to their appointments. For these families, this is much desired, reduces stress, and provides an important aspect of support. Coordination includes the gathering of pertinent information, keeping notes for themselves of who family has seen, their condition and desires, etc. That can include setting up consultations and could mean accompanying them to the visit and/or preparing them for the visit. Reviewing clinical notes from visits from providers is also very helpful.